I'm really intrigued by the fact that so many people with low back pain, nearly all in fact, find themselves stretching the tissues of their low back for relief. And I'm curious about it because I don't know if it's cultural and it's specific to the US or maybe the Western Hemisphere, or if it's a physiologic kind of response that all of us have. But this need to stretch what hurts, I don't think is serving many people. Actually, I'll say it's not serving many people. And I'll elucidate why. But stretching is taking tissue on stretch. That's what we think of when we think of that term. Primarily, we're thinking about muscles, but you can also stretch capsules of joints and ligaments and tendons and fascia. Any tissue that's capable of stretching is something we can stretch. But when you are stretching tissue, you're obviously also moving a joint in this case. In this case, you're moving the low back joints into flexion. So while I find that it's true most people get some temporary relief with low back flexion for their low back pain, the key word there becomes temporary. And I know this because I experienced it myself. I had episodic low back pain for many years that disrupted my life. I would get into child's pose and stretch specifically, mostly to the left, in order to stretch the right low back. And after many years, I finally came across Robin McKenzie's work and figured out there were specific joint movements that could easily fix my low back pain by just getting the joints mechanically moving well again. It had nothing to do with tissues. And I can usually debunk a lot of ideas about tissues by, talking about how tissues actually work and then, relating it to the person's presentation or symptoms. But when it comes to low back flexion, there's 4 primary ways we round or flex our low back. There's toe touching in standing. There's lying on your back and bringing your knees to your chest. That is flexion or forward bending of the low back. You can tell because that low back is rounding, of course. The chest is getting closer to the thighs. That's flexion. There's also child's pose and kneeling. You can also do it in a similar way by just putting your hands on the kitchen sink and really dipping your buttocks down and stretching that way. And then there's of course seated low back flexion, which is when you're sitting and then you reach down and perhaps grab your ankles or grab the bottom of the chair and really stretch. So when it comes to stretching, again, we're talking about tissues. So I find that very few problems in the low back are actually due to tissues being tight. In fact, I've never found a real low back presentation where the problem was tight tissue. I find that most patients, 70 to 80% of patients, have joint problems that need to be moved in a specific direction to get better. And that specific direction is rarely flexion. I did a case report recently, or I did a video about a case report recently where a young man did need flexion to get back into the swing of things, but that's under 10% of patients. So when you're flexing, people are either subconsciously or consciously knowing that they're stretching tissue. But even if you did have a tissue problem, let's say you strained a muscle in your low back or you sprained a ligament in your low back, when it comes to the initial therapy, stretching is not indicated. Think about it this way. If you tore a muscle or strained a muscle in your leg, would you continue to stretch that muscle or would you let it heal? Same with a ligament sprain in your ankle. You wouldn't keep elongating or putting that ligament on stretch. You would want to preserve its or keep it shortened so that it could actually heal. And only later would you start to really try to push the boundaries and get it back to its normal length. So stretching is a phenomenon that we associate with tissue. And if tissue is the problem, by all means, let's stretch it. But that's so very rarely the case that that's the diagnosis for an orthopedic disorder. So I find most patients need extension, or they need side glide to the left, or they need flexion and rotation to the right. The reason is not because that's my fancy way of stretching your tissue. The reason is because the joint disorder is the actual problem, and you fix that by moving the patient into the direction that the individual patient needs. So flexing may temporarily feel better, absolutely. I don't actually think it feels better because you're stretching tissues. I think it feels better because you're opening the posterior compartment of the spinal joints, meaning you're taking pressure off the back of the joints. And I think the back of the joints is where most lesions are. We know that when discs tend to move, bulges, herniations, etc., they by and large go posterior and posterior lateral. So not all of these problems are frank disc problems, but most tend to go into the posterior compartment. So for most people, going forward, again, takes that pressure off the back, the posterior compartment of the joints, and it temporarily feels good. But I'm a big believer in prove to me that it's actually helping you, because proving to me that something fixes you is not only temporarily relieving symptoms, but it's long-standing effect of symptoms being gone and signs being reversed. So a forward bending of your low back definitely reverses your symptoms, gets your pain gone, and reverses your signs. So your range of motion is restored, your nerve tension, if it was lacking, is restored, and any muscular weaknesses in the lower body, if they were lacking, is restored. By all means, flex. But I just want people to really question why you're doing this, because I so rarely find that moving a person into a lot of flexion is going to fix the disorder in their low back.